Alison Snyder. I'm one of the managing editors here at Axios. I'm really excited to have our next guest, Dr. Anthony Sandler. He's the surgeon-in-chief, at Children's National Hospital here in DC. We're going to chat for a few minutes, then we're going to do a demo, which is why we have this unusual setup here. So we're going to be moving a little bit. Just roll with us, please. And with that, please help me in welcoming Dr. Sandler to the stage. All right, thank you. All right, so we're going to chat for a few minutes, and I wanted to start by asking you, we read a lot about this from a scientific standpoint being a golden age in medicine, right? There's RNA vaccines, there's gene editing, there's weight loss drugs, immunotherapy, so many different things. But you're working with a very special population. And so to start, can you just give us a sense of how these things are actually changing pediatric care in particular?
Yeah, absolutely. Firstly, thank you for having me, Alison. It's a pleasure to be here and to represent Children's National. The healthcare is moving very fast. And what often happens in adults also happens in children. Unfortunately, most of the research is directed initially at adults and then kind of whittles down to children. At Children's Hospital, we're trying to turn that around. We're trying to do research for children that will then whittle its way up to adults. We're turning it on its head. As you said, it's an incredible time in research. It's incredibly exciting. The breakthroughs that are happening continuously are amazing. And I have two daughters who are starting their medical careers. And I'm a little envious because I'm towards the end of my career. And I think the next 15 to 30 years will really change the way we deliver healthcare.
And your specialty, you're a pediatric surgeon. How about, I think, again, we see stories or we write stories about, robotic surgeons, things like that. How is your particular field changing?
So there's two ways to look at it. I'm going to speak specifically to Children's National. About 15 years ago, we were given a gift from United Arab Emirates to create a Institute of Pediatric Surgical Innovation. And our goal for that was to do things less invasively, more precisely, and pain-free. That was kind of the mantra that we started with. And it's really expanded incredibly well. We really are changing the way we do healthcare in children, especially surgery. We're miniaturizing the devices we use. You spoke about devices and innovation. And so much of that is becoming part of our regular practice that we're doing all the time now. From my own interest in research, I do a lot of cellular therapy. That's sort of one aspect. And I think that's going to change a lot of the future. There's limitations of surgical abilities. When cells are floating around the body, you have to target them with other means. And I think immunotherapy and cell therapy and training immune cells to actually target and kill cancer cells is the future. We have artificial intelligence that's permeating its way throughout healthcare on all levels. The last speaker was speaking about it. It's going to change the way we deliver care. It's going to make, hopefully it's going to allow us to spend more time with patients and less time with administrative tasks. We're also working with devices at our institute. And we're doing some incredible work with devices. We're looking at a nociceptor, a device that can actually measure pain. We're doing work with robots that potentially can autonomously do surgery. So you're cutting the surgeon out completely almost. That's two of the projects that we're working on in the Institute. And then there's all kinds of other devices where you can enhance the imaging and the capabilities of what the surgeon can see in the operating room with fluorescence technology, laser spec, multi-spec, and also depolarizing imaging that can enhance the view, that can help the surgeon see what they cannot see.
It was not your job to set up the demo, but you just did a very good job of it, so thank you. I want to go ahead and call your colleague, Dr. Shekhar, out. We're going to get set up with this demo, and we're going to move a little bit. All right.
We would love to bring our big robots in here, but you can't do that, so I think this is a really nice demo to show.
So can you start off by telling us a little bit about, just while he's getting set up, what the problem is that you're trying to solve here with this device and what the challenge is and what we're sort of you're trying to tackle.
So Dr. Shekhar's
Sorry, I'm going to
group,
ask you to speak.
okay,
Sorry, you can speak.
does
You're more important than me here.
does
Okay.
augmented reality? No, that's not true. Does augmented reality, and this device itself is sort of allowing an image. So he's using ultrasound here, and we do a lot of procedures with ultrasound guidance, more precise. This was one of the goals. And what this actually does is you don't get the view that he's actually seeing.
I think we will in a second.
Okay. The ultrasound shows you your target. Normally when you're doing a procedure on a patient using ultrasound, you're looking at a big screen on the ultrasound machine, and it's usually a big machine that's pulled in, and you have to work like this and look like this, so the ergonomics don't work. The idea of this ultrasound is it's in line of sight. So you're actually looking at the patient, you're targeting either a biopsy, a blood vessel, or whatever you want to put a catheter in somewhere, and use the ultrasound to actually identify the site, and then you can put it in straightforward in a very ergonomic way. It also allows autonomy. What he's doing there, unfortunately, you're not seeing the picture, but what he's doing there is actually controlling the size of the image, the gain of the image, and you're not seeing it, but what's happening is the ultrasound is going up, it's going down. He doesn't have to take gloves off and go work on the machine. He can do it all from the side of the bed while he's sterile.
Can you give a sense of, I guess, outcomes that you can share with us about, with the technology? There you go. Whoop.
Edit mode.
All right, so
Scale down. Scale down.
He's
giving voice command. Thank you.
Move down. Move down. Center image.
So the augmented reality, he sees the picture in front of him, he sees what's going on around him, and then he also gets the ultrasound image in the screen.
Pen mode.
And that allows him to do access directly.
And so, just revisiting my other question, what are some of the outcomes that you see from this? And from both, I guess, maybe the patient perspective and from the physician's perspective, how much easier does it make your job?
So I have a saying in surgery, a lot of my fellows and residents will tell you that if it's easy on the surgeon, it's easy on the patient. In other words, if the surgeon's struggling, it's more difficult for the patient. There's more risk of complication. There's more risk of doing the wrong thing. So this is really facilitating the ease of the procedure, which I think will obviously translate to a benefit to the patient.
Got it. What are some of the pain points with something like this? Not aside from demoing it on stage. What are some of the pain points in terms of rolling this technology out and using it in the clinic?
I think physicians are used to doing something one way. Oh, I can do it. I don't need that.
Yeah.
And I think it's just getting the practice to change to accept the new technologies. I think that's always somewhat of a limitation, but I think these new technologies are going to change the way we do care.
Great. Thank you so much, Dr. Shekhar. Thanks for bearing with us. I like it, appreciate it. All right, we're going to take another seat here quick. So I guess one of my other questions is, what are some of the, risks and limitations of relying on tools like this?
Well, there'll always be risks. Because technology can break down, and people become more dependent on it. And let's say you have an autonomous surgery by a robot that's going to remove the gallbladder, and it's become sort of part of the routine. And then the surgeon who's overseeing it, the robot breaks down, the surgeon may not be as well trained to do the operation themselves. So there will be risks, there'll be valid risks, but you can't stop the technology. I mean, if we look at the capabilities of the last 30 years where we've had CTs, MRIs, PET scans, I mean, it's become part of the practice. And I think we'll adopt it, we'll learn to adopt it, and we'll have strategies to prevent breakdowns and complications.
You mentioned earlier on you have two daughters who are they're going into medicine?
One's third year of orthopedic surgery, and one's in a third year of medical school. Yeah.
And you mentioned being envious of them. So I'm curious, can you say a little bit about more why that is, and I guess sort of take us forward 10 years, what technology you think will actually sort of completely change your field, or maybe their fields for that matter?
Well, artificial intelligence, and the last speaker was alluding to it. We've gone through a bit of a difficult time where All the documentation we have to do for billing has really been cumbersome and difficult for physicians. Now there's some technology where you go into the patient's room, it listens to your conversation, it writes a note for you, you check the note and you sign it. I'm envious I think they're going to get back to taking care of patients. I think the technology that they're going to have is going to be extraordinary, and it's going to really facilitate the care. And I think what I alluded to earlier with things like immune cells and cellular therapies, I think it's going to change the face of healthcare.
I want to ask you, because I actually have a little bit of time. For a long time, there was sort of a promise of personalized medicine, right? And with the advances in imaging, as well as genetic data, AI, again, thinking about the younger patients, is that going to become a reality? Do you think more personalized medicine?
The personal bias, I think it will. Mm-hmm. I think we'll get smarter about how to... one of the holdups with that, however, will be the business aspect of healthcare. If it becomes personalized, there's not a big business model where you grab something off the shelf and then develop it. And I think business is important to developing products. But I do think that there will be a lot of personalized care.
That's all the time we have today. Thank you so much. Thank you to Dr. Shekhar and your team for coming and joining us.